6 years ago or so, I was treating a child. She was 16 years old. She had a double severe scoliosis, spinal curvature. She couldn't sleep. She was miserable. Through chiropractic adjusting, I straightened the top curve out. The bottom curve in her low back was not going to straighten out, and I'm stretching her lumbar aponeurosis, that thick leather covering. I'm explaining to her if she hangs upside down on the inverted track regularly, and if she doesn't do any long distance running, and if she doesn't do any heavy lifting, she can have a comfortable life with her distorted spine. And as I finished telling her I couldn't fix it, it was gone. And I went, how did that happen? And so I got on it and I researched it. One stretch posture I have for the low back, when the pressure is applied, as I shall describe to you, the scoliosis goes away in a matter of minutes, even if the people are older, even if people in their 60s, for a moderate to mild curvature that's functional. There's another posture for the thoracic spine that when applied with correct pressure, that also resolves in a matter of minutes. And certain stretching techniques which emulate our stretching, which are self-produced stretches, can maintain the spine free of scoliosis. This is important information. It's an awesome discovery. This is going to be huge for the people who become competent at scoliosis resolution. It's worth buckets of money. People with scoliosis, they're in constant spinal discomfort. Please study that chapter on your video and in your book. Lean your head forward. I go like this, turn on her spine to push in the lamina grooves deep. I'm checking. There's a curvature you're going to feel. It's going to go hard to one side and then back. It's coming down straight, 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 straight. Lean forward, please. Straight, lean more, lean more, lean more. I sometimes brace them there, all the way, lean over, lean over, lean over, lean over, lean over, all the way down. That's how it's checked. Pushing in the lamina groove super deep so that you can feel where it is. And I mean, when I teach this course, and let's say I have 15 people in the class, 3 or 4 are going to have a significant scoliosis. It is a health concern that is rampant. Here is my second most important stretch. This is the costovertebral ligament stretch. This is stretching ligament to tie the ribs to the spine. Ligaments tie bones to bones, tendons tie muscles to bones. The ribs are not fused to the spine, they have movable joints. Got it? So, the ribs don't just go from the back to the front, they go backwards first. There's a little arching backwards where we're going to hook the rib as it arches backwards. We're going to start with our contact in the lamina groove. There's a groove on each side of the very center of the spine. That's the lamina groove, where we're going to contact from the 12th rib all the way up to the first rib. Put this hand under your head, please. So, here's the big switch. I pull her back up off the bed here. I reach a hand under, I let the arm go, and I switch hands. Did you get that switch? I now stabilize her hip in the anterior superior iliac spine. I draw my shoulder in, and I contact the rib at the rib neck, either with 3 fingers shaped just like that, or I can grab several ribs with a hand contact. Commonly, I'll do 1 rib at a time. I pull her rib away from her spine by leaning backwards. That's part 1 of this move. Part 2 is I move towards her head and I elongate her spine and I breathe. I elongate and I wait till it moves a little bit. You just let go. Now, I'm going to go either up her rib cage or down. You can start anywhere you like. I'm going to go down. I've got 1 rib. You have to start close to the spine. I pull the rib off the spine. Part 1, part 2, I lean towards her head. and I elongate. I have my knees bracing on the table here. I may not look comfortable. I am comfortable. I'm floating upwards. I'm a balloon head. I wait for the release. You can work all the way up and down, focusing on where it feels tight. As we get up closer to T1, we may have to reach in for the rib contact from the front. Now, if it's a big, heavy person, I may not need to pin the hip. I may just go hand on hand like this and do both hands on the area that I'm wanting to stretch. I would like you to please move with your head down to this end. In practice, I would have walked around the table. For the filming, I'm having Christy move. It's not necessary to have them put the hand under the head. When I'm treating people, I really don't want to be having conversations. I want them to go off to La La Land and just go deep and relax and enjoy the experience. So I'm going to talk to them as little as I possibly can. I'm probably not going to say put the hand under the head, although I may prefer that it's there sometimes. I just take the hand and put it up there, as long as it's out of the way. Here comes the big switch. I pulled her back off the bed, got a hand under her back, I switch hands, I brace her anterior superior iliac spine, the front of her pelvis. I have to reach in and touch on her spine next to the very midline in the lamina groove to pull, to hook that rib. I can grab one rib or several ribs, and I pull by leaning backwards. My knees are touching this table. Part one, part two, I elongate her spine, and I hold and I wait, and it just let go. I'm going to go up a little bit. I'm going to pin the pelvis and pull the ribs away from the spine and elongate the spine and wait. Remember, I can go hand on hand if it's a heavy person. As I get higher up, I may contact her upper ribs by coming from above the shoulder, just like this, and stretch those ribs away from the spine. Same concept. Great. Now, one reason this is one of my most important stretches is this posture miraculously and stunningly corrects moderate to mild spinal curvatures even in people who are older. When doing this work, people may have had a spinal curvature in their spine since they were 13 years old, and they're 45 now, and it's bugged them every day, and all of a sudden it is gone, and they get emotional and say things like, the monkey just got off my back, and they cry and cry and cry. So just realize that this can be an emotional release trigger here. Osteopaths sometimes push a bone the wrong way, and then the body's connective tissue says, no, I don't want to be pushed the wrong way, and it pushes against the osteopath and finds its way back into place. That's called an indirect technique. In my profession, chiropractors, we move bones from point A to point B. That's a direct technique. This is an indirect technique. If her spine has apexed to the right like that, I'm going to contact it on the high side, and I'm going to pull it the wrong way. Yeah, I'm going to make the curvature worse. Here we go. Let's play like you had a spinal curvature with the apex right here. What I do in the evaluation is I take a pin and I draw it where it is, so I would be sure I have the exact right contact. For your information, there are simple scoliosis where the spine is just crooked, out of place, going to the side, and then there's a rotatory scoliosis where it's crooked and torqued. That's the hunchback where the rib cage humps up on one side. That's a rotatory scoliosis. Functional scoliosis respond to this. If the bones have grown that way, if it's an anatomical scoliosis, it's not going to change. It works almost every time, and it still blows my mind. It is just so much fun. People love it, and I regularly host here in this office Scoliosis Resolution camps where people just come in here through Facebook, and I teach them how to do it, and I help people who have scoliosis in those camps. And we have food. So, with the scoliosis, it's basically the same technique. I pull this arm up, get under here, get here. I'm on the high side of the curve. I'm making the curve worse. I pull it away from the body, and I elongate her spine and elongate myself upwards, and I hold it, and I wait for it to start moving. When it starts moving, basically everybody I teach this goes, oh yeah, I can feel it. It's moving, it's moving, it's moving. You let it win. If you pull too hard, it doesn't work. Keep in mind the connective tissue is one piece. It's my theory that the connective tissue in her feet and the connective tissue in her neck have all joined into this one thing. The bones didn't just fall out of place. They were pulled out of place by the connective tissue. So I wait, and then all of a sudden it stops moving. I go, oh, okay, it stopped. You wait a little while. It starts moving again sometimes. It's moving, it's moving, it's moving, it's moving, it's moving, and it stops, and I wait until it stops and it stays stopped. And then I stand them up and I check it. Commonly it is either gone or it is tremendously improved. If it's not gone, I do it again. And if it is better and it's not gone, I switch it around and I go to the other side and do a direct technique, pulling it into place, same technique. I would have you turn, Chrissy, go on and turn for me. Let's say it improved by 75%. I would now come to the other side. I'm not pulling to make the curvature worse, I'm pulling to make the curvature better. Sometimes that finishes it off. Now, occasionally, it's say 85% better. It needs a manipulation. It needs a chiropractic adjustment to finish it off. For people who follow through with the self-treatments, the scoliosis may stay clear lifelong. For people who do not follow through with the self-treatments, the scoliosis tends to come back. If the connective tissue is used to being out, it pulls it again out. For people who feel great for an extended period of time and are doing their self-treatments and then stop doing their treatments, it tends to come back again. This is such an important stretching concept, I figured out how to do the stretch to myself with the connective tissue strap. In my Quick Self Fixes book, I have a chapter on the connective tissue strap procedures A through D. It's such an important chapter that I took it out of that book. Well, it's still in the Quick Self Fixes book. I pulled it out and have a video and book strictly on the connective tissue strap procedures. For people who have scoliosis and choose to be self-reliant, this is a must-have. Here is the lumbar connective tissue stretch. Remember, the lamina grooves are on each side of the very center of the spinal column. I'm contacting the lamina groove on the high side with a thumb-on-thumb contact. I find the spinous process and then the direct center and glide into the thumb on the high side. There are 5 lumbar vertebrae, 5, 4, 3, 2, 1. I go to L3, I find the spinous process, and I go into the lamina groove of L3 with one thumb. I do a second thumb contact, I push straight in and I hold and I wait for it to release. What I'm stretching here is the ligaments that tie the vertebrae to each other and the discs between the vertebrae and the synovial membranes of the facet joints. Once I feel that release, then I grab the lumbar connective tissue, the fascia, and I pull it that way. I pull it medial to lateral. I'm not pushing with my arms like that. I am lunging, and I hold and I wait for the release. That's L3. I come down to L5 at the base of the spine, just above the tailbone, in the lamina groove, thumb on thumb contact. I push in and I wait until the intervertebral lumbar ligaments let go. It just happened. Now I drag that tissue up toward the ceiling and around, dragging it from the spine up and around, and I wait for the release. And now I find the 12th rib. I follow the spine. That's thoracic 12. I come down one. That's L1. I push in L1 in the lamina groove, thumb on thumb contact. Push in, wait till the intervertebral ligaments, discs, and synovial membranes let go. I sink in a little bit. Now I drag that thick leather covering toward the ceiling, medial to lateral, away from the spine, and wait for the release. I've done L3, L5, L1. If I have time, I'll do L4 and L2. Christy, could you please turn with your head to that end for me? There you go, thanks. Same thing on the other side. I'm in the lamina groove of L3 between the sacrum and the rib cage. I'm in the deep in the groove, thumb on thumb contact. I push straight in, posterior to anterior, and I wait for that release. You can feel it, you'll find it. It's there, it's real. Got the release. I now drag the tissue from medial to lateral, thumb's pulling up toward the sky. Hold, I wait for the release. Same process at L5, go to the base of the spine above the sacrum, in the lamina groove, thumb on thumb contact, deep in, pushing back to front. Wait for the release, and now drag that thick leather from medial to lateral up toward the sky and wait for the release. Going to T12, where the 12th rib is, finding L1, going thumb on thumb in the lamina groove, thumb on thumb, push in, wait for the release. All the while, I am floating up. I am being a balloon head. That is a way of life for me. Now I drag the connective tissue away from the spine, up toward the sky, medial to lateral, and hold and wait for the release. And again, if there's time after doing L3, L5, L1, I'll do L4 and L2. So here, when there is a scoliosis in the lumbar spine, and buddy, there, I'm going to contact on the high side of the curvature. I'm going to pull it to make the curvature worse. Keep in mind, there are simple scolioses where it just leans to the side. Rotatory scoliosis are complex. They lean to the side and they rotate. These vertebrae get bigger and bigger and bigger to bear weight. If I can get the curvature out, but not the rotation, I'm pretty darn happy with that, because the weight-bearing load has shifted to the vertebral bodies in front. With a scoliosis, the person's eyeballs are over their symphysis pubis, but they're having to work so much harder to stand up with the eyeballs balanced over the pelvis. By the end of their day, they're sometimes wasted. So getting the spine straight, whoa, they are so grateful. So with a scoliosis, let's say that the apex is like that. Apex is going to her left. I come to the high side of the apex. I pin thumb on thumb, and I pull that way, making the curvature worse. I hold. If I'm holding too hard, it is not going to work. You got to focus here. You got to feel it. You're going to feel it. It's going to start tugging, pulling to straighten itself out. It is as though every potential piece of her tissue that can chip in here and pull gets on it. And within a matter of minutes, it pulls the scoliosis right out and straightens it up. Keep in mind, it may pull, pull, pull. It's pulling, it's pulling, it's pulling, it's pulling. It stops. It got tired. It needs to rest a minute. It starts pulling again. Pull, pull, pull. You're going to go, wow, I can feel it moving. It's going to keep pull, 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 pull. It may stop. And eventually it's just going to stop and stay stopped. You stand them up and recheck them. If you have any musculoskeletal symptoms or a previous medical diagnosis concerning your spine, ask your medical doctor, osteopath, or chiropractor if the connective tissue strap is safe for you. For instance, disc herniations may be made worse by using the connective tissue strap. It is very important that you do not use the CT strap where there is pain or cause pain using the CT strap. Using any more than a gentle force is not safe and may cause harm. Remember, by gently using the CT strap daily, over time, the connective tissue associated with your spine will become relaxed in a sustainable way. I have conclusively proven that gently using the connective tissue strap makes and keeps targeted chronically weak muscles strong. Resist the urge to use more than a gentle force. Also, only use a connective tissue strap exactly as I instruct or you may cause harm. There is no need to experiment with the CT strap on your spine. I have already done that for you. Focus on holding each stretch between 5 and 8 seconds. Older people may need to stretch for 8 seconds, while younger people may need to stretch for 5 seconds. It really depends on your current flexibility, not necessarily your age. This is my friend Christy. Thank you for helping me, Christy.
It's my pleasure.
Please have a seat right here. In assisted yoga and yoga, when connective tissues relax, the body moves a little bit. So I'm going to stretch Christy to the side here. Let your body go all the way to the side. There we go. And I'm waiting for her body to relax, and there it went. When it went, I moved a little bit with her, following her into her lean. It's a very subtle body movement. As connective tissues relax, it can be seen in the mirror. So, when you are practicing with your connective tissue strap, start practicing in the mirror, watching for the connective tissue release, so that you know when the technique has completed. Here we go. I'm waiting for the release. I'm waiting. Waiting, there it went. We moved, yet ever so slightly. Same concept here. I'm torquing Christy's spine, pushing up on her spine, and I'm torquing her and I'm waiting. And there it went. Her body moved and gave just a little bit deeper into the torque. Torquing Christy's upper body. I'm waiting for the movement. I'm waiting. There it went. It's very subtle, very slight, yet it is certainly there. And now for the connective tissue strap routine. At first, working with the connective tissue strap will be awkward. Soon, with repetition, it will feel as normal as brushing your teeth. By itself, this connective tissue strap section is an awesome addition to any yoga workout. This is micro-stretching of your spinal connective tissue using the CT strap to reach places you cannot reach and stretch yourself. In very simple terms, using the CT strap along the spine is like playing tug of war with your spinal connective tissue. It's all about creating opposing forces for pulling specific connective tissue apart, creating and sustaining gentle yet firm stretches. You may order a connective tissue strap from me, see www.quickselffixes.com, or call 404-808-4280, or you can easily make your own. This is how to make 2 connective tissue straps, one from a beach towel and one from a sheet. Find the longest beach towel that you can find and cut a 6-inch swath in it. Wind the beach towel up, starting in the center, making a rope. The secret to a good strap is to have it super tight. Use your foot as a brace. Now, tie a loop in the center of the strap. Focus on keeping the knot in the center of your strap and tighten it up. Tighten it up super tight. There. This is my preferred connective tissue strap for using in the shower. The heat from the hot water on my back makes for better stretch. I hang it over the shower head, and I'm in the shower looking at it, and I use it almost every day. Here's how to make a connective tissue strap from a sheet. Take a top sheet and cut a 2-foot swath in it. Now, wind it up, starting in the center. Wind it up as tight as you can. Use your foot as a brace. My protege, Greg Tinkle, who teaches yoga, helped me figure out how to make a new and improved connective tissue strap, and that's what we have here. Thank you, Greg. Once wound up tight, make a standard loop. Now, the piece that comes out from above goes under and through, and the piece that comes out from under goes over and through. Tighten it up, focusing on keeping the knot in the middle. Tighten it up as tight as you can. And here you have one of the greatest inventions of the 21st century. Top sheets have different thread counts. If it's a heavier thread count, a thicker sheet, your length may be less. If the thread count is less and it's a thinner sheet, you may need a longer piece. Play with it. Create a knot about the size of a large chicken egg. You are welcome to purchase connective tissue straps from us at quickselffixes.com or happily make your own. First is a connective tissue strap procedure for the low back connective tissue. This technique stretches connective tissue in the low back, focusing on stretching the thick connective tissue called the lumbar aponeurosis. The lumbar aponeurosis is just underneath your skin and it covers your entire low back area. It is thick and tough, just like leather. Restrictive tightness in this connective tissue is the most common cause of low back discomfort. When you use the CT strap, always move very slowly and be gentle. Do not cause any pain. Moving slowly and gently creates safety. We will perform this procedure 3 times in the low back, starting in the middle of the low back. Place a connective tissue strap ball or knot in the middle of your low back between the top of your tailbone and the bottom of your rib cage. There's the top of the tailbone. Here's the bottom of the rib cage. The ball placement goes right in the middle. The lamina grooves are on either side of the absolute middle of your entire spine and are actual grooves. Here are the lamina grooves. The ball placement goes just next to the very center of the midline and a little bit to the right, still on the spine. On my body, here's the bottom of my rib cage. There's the top of my tailbone. The ball goes between those 2 points. From the absolute midline of my spine, I go a little bit to the right into the lamina groove. There's your ball placement. People often place the ball too far to the side. Correct ball placement is essential. Stand with your feet shoulder width apart. Bring the 2 ends of the strap forward around your waist, inside your arms, and hold with both hands. Anchor the left CT strap by pulling it across the front of your abdomen parallel to the floor, keeping it at the same level with the ball on your spine. You've set your pin, now let's stretch against it. Pull the right CT strap away from the body parallel to the floor and diagonally to the right. You are not pulling the CT strap to the front. You are not pulling the CT strap to the side. You are pulling it diagonally, exactly between pulling to the front and pulling to the side. Next, lean to the right from the CT strap ball as you continue pulling firmly on your right CT strap diagonally away from your body. Pulling firmly does not mean pulling hard. Now, increase this lean a little by pushing your low back at the CT strap ball to the left as you bear more weight on your right foot. Keep pulling the CT strap right. Now, really elongate your spine by stretching upwards toward the ceiling. Lean backwards just a little bit to increase your stretch. Breathe and hold this stretch for 5 to 8 seconds as you focus on stretching this thick leather-like connective tissue over your low back. Pulling your right CT strap diagonally to the right and pushing your low back to the left creates an opposing force, giving the low back connective tissue a very specific stretch. This is analogous to playing tug of war with a thick leather-like covering over your low back. Here is the same procedure for the other side of your low back. Shift the ball over the midline of your spine. Move the ball just to the left of the absolute center of your spine. Here we go. From the right lamina groove, there's the midline of my spine, there's my left lamina groove. Remember, the lamina grooves are on both sides of the absolute center midline of your spine. People often place the ball too far to the side. Stand with your feet shoulder width apart. Anchor the right CT strap by pulling it across the front of your abdomen parallel to the floor, keeping it at the same level with the ball on your spine. You've set your pin, now let's stretch against it. Pull the left CT strap away from the body parallel to the floor and diagonally to the left. Remember, you are not pulling the CT strap to the front, you are not pulling the CT strap to the side, you are pulling it diagonally. Lean to the left from the CT strap ball as you continue pulling firmly on your left CT strap diagonally away from your body. Increase this lean a little bit by pushing your low back at the CT strap ball to the right as you bear more weight to your left foot. Now, really elongate your spine by stretching your spine upwards and lean backwards just a little bit to increase your stretch. Hold this stretch for 5 to 8 seconds as you focus on stretching this thick leather-like covering over your low back. Replay this procedure twice more, performing it on the right and left, first at the bottom of your low back, just above your tailbone, and second at the top of your low back, just underneath your rib cage. You will repeat it here, and here, and here, and here. This technique stretches connective tissue along the spine, focusing on stretching ligaments which tie the ribs to the spine. Ligaments are tough, slightly flexible straps which connect bone to bone. Ribs are not fused to the spine. They have actual movable joints connected together with ligaments. Find the bottom of your rib cage and follow it to where it meets your spine. Place your connective tissue strap ball right above the bottom of your rib cage, just to the right of the very center of your spine. Stand with your feet shoulder width apart. Place the connective tissue straps on the outside of your arms, just above your elbows. Anchor the left connective tissue strap by pulling it across the front of your body parallel to the floor. This must be a gentle pin. If this pin is too tight, this technique does not work. You've set your pin, now let's stretch against it. Pull the right connective tissue strap diagonally to the right. From the connective tissue strap ball, lean your upper body to the right. Increase this lean by pushing your spine at the connective tissue strap ball to the left as you bear more weight on your right foot. Release a little more tension in your left connective strap now. Elongate your spine upwards. Keeping a firm tension in your right connective tissue strap, pull the right strap diagonally up and hold. Now, mildly rotate your torso left by pulling your right connective tissue strap gently forward and to the left. Lean backwards just a little bit to increase your stretch. Breathe deeply several times. Hold this stretch for 5 to 8 seconds. Focus on tractioning the ribs away from your spine. Pulling your right connective tissue strap diagonally to the right and pushing your lower rib cage at the connective tissue strap ball to the left creates an opposing force that gives your rib ligaments an awesome and safe stretch. Here is the same procedure for the other side of your lower rib cage. Shift the ball over the midline of your spine into the left lamina groove, placing the ball just to the left of the absolute center of your spine. Here's the ball in my right lamina groove. I'm passing it over the center of my spine into the left lamina groove. Stand with your feet shoulder width apart. The connective tissue straps are on the outside of your arms just above the elbows. Anchor the right connective tissue strap to your body by pulling it across the front of your body parallel to the floor. You've set your pin, now let's stretch against it. Pull the left connective tissue strap diagonally to the left. From the CT strap ball, lean your upper body to the left. Increase this lean a little by pushing your spine at the ball to the right as you bear more weight on your left foot. Release a little more tension in your right connective tissue strap. Now, elongate your spine upwards. Keeping a firm tension in your left CT strap, continue pulling it to the left and diagonally. Now pull it up towards the sky. Rotate your torso to the right by pulling your left strap gently forwards and to the right. Lean backwards just a little bit to increase your stretch. Breathe deeply several times. And hold this stretch for 5 to 8 seconds as you focus on pulling the ribs away from your spine. You may perform this procedure at multiple levels going up your rib cage. This completes the connective tissue strap routine for the 20 lower rib ligaments.